you get maybe 1 or 2 lessons on natural medicines. And basically, the long story short is, well, just because it's natural doesn't mean it's safe. So then I chalked it up to, oh, well, it's not safe, so I'm not going to use it until 3 years ago. So here I am. I've got a couple pharmacists on my team. Actually, my entire pharmacy department at the hospital is now kind of on my team. So kind of just wanting to build that out and infiltrate Western medicine more, and kind of be that conduit between both worlds. So
thank you, Mary. Jess, will you introduce yourself?
Hi, everyone. I'm Jess Goodman. I am from Denver, Colorado. Well, I'm from like the suburbs of Denver, Colorado, and I've lived here pretty much my whole life. I graduated from acupuncture school. I went to acupuncture school in Boulder, and I graduated over a decade ago. So I've been practicing. I've been a licensed acupuncturist and Chinese herbalist for the past 10 years. My history is I owned a pretty busy, successful clinic in the Highlands and sold that right before my oldest son was born. And I've kind of been on an extended maternity leave, trying to figure out how to pivot and come back into the world, like with full steam ahead. Now that my boys are a little older, I have a 5-year-old boy, and then I have twin 3-year-old boys. So I have a few lenses that I look at health through. My primary one is, of course, Chinese medicine. That's just the lens that makes the most sense to me. I've always been told that Chinese medicine is in my blood. My great-great-grandfather was the herbalist to King Kamehameha in Hawaii. So I have all of these ancient texts I have yet to transcribe that are like herbal formulas that he created for gynecology and obstetrics. So yeah, I come from a long lineage of Chinese medicine practitioners. My main population of people that I have worked with for my career have been women and children. So women, primarily women who have been trying to get pregnant, and then also helping women through their pregnancy and then their postpartum period. And then I have quite extensive knowledge in pediatrics as well. Most recently, and I've been on Jess's team, let's see, I started using oils right after my oldest son was born, so about 5 years ago. And then I started doing the business right around the time when my twins were born, so just about 3 years. And then most recently, I started doing a one-on-one mentorship with Desiree Mangendog, who's also an acupuncturist and pretty successful with doTERRA. So she took me on as her first student, and I've been studying with her since the beginning of February. So I'm really kind of like dreaming now about pivoting to more of, rather than working one-on-one, looking at like how I can work in a one-to-many type of setting. So looking to do more like remote work, some distance healing. I've been studying a lot of energy medicine with her. And I'm also in the midst of starting an online course offering. Like I'm developing it with her as we speak. So I'm excited, and I'm excited to be here with all of you. I really love speaking about all things health. So I'm excited to hear from all of you as well.
Thanks, Jess. Jess was in the delivery room with me when I was birthing my son, so I trust her acupuncture in a very intimate way. Ange, will you introduce yourself, please?
I'm Angie. I'm from Brooks, Georgia, so that's where the Southern drawl comes from. I have no medical degree, no medical experience. Can't compete with anything of this. I'm here totally out of curiosity. So that I can speak more intelligently to others.
Perfect. Thanks, babe. Good to see your face. Hey, Vanessa, why don't you unmute yourself and introduce yourself, please?
Hi, I'm Vanessa. I am just getting involved with doTERRA. I work with Emily, who's a craniosacral and doTERRA representative, and she introduced me to oils through different experiences that have been really profound. And so it piqued my interest. And I've also gotten to speak with Jess Goodman as well and do a session with her, which was amazing. And have done 2 of Desiree's workshops as well with the oils. And So I've been doing acupuncture with needles and energy work and high vibrational oils, not essential oils, and do more woo-woo kind of acupuncture called esoteric acupuncture. And it's based on sacred geometry and the chakra system and the Kabbalah. And I also do yoga, trauma-informed yoga, yoga nidra. And so I do workshops around Denver that incorporate all of those things. And now that we're in this new reality, I really could see the using oil, essential oils from afar and have people use them themselves as part of that instead of using needles. So I'm just in this pivot place as well. And so I'm excited to be part of this. And I've been doing a lot of reading with the different Chinese medicine viewpoints of essential oils. And I think that it will be an exciting blend of the two worlds.
Perfect. Thank you, Vanessa. Oh, I want to hear more about your woo-woo because I'm studying some woo-woo too. So we should chat offline about that.
Okay.
V, what's up? We've got a Bro Terra in the house.
Yeah, so I guess I represent Bro Terra. I've been studying martial arts since teens and took me to Asian internal arts where I got permission to teach Chinese from my Chinese teacher. Teach Tai Chi from my Chinese teachers, which took me to the energetic healing stuff of Qigong, where I'm studying for certification now. I met Jen, who introduced me to essential oils, and I saw the alchemy possible from being involved with them, and have just been a devotee ever since. And I'm just here to hear more about it.
Yay. I love seeing you, V. Leah, will you just unmute yourself and introduce yourself and what you're up to and all that?
Hi, yes, I'm Leah. I'm in Alameda, California, so right by San Francisco, and I'm fairly familiar, or well, not very familiar, I'm sorry. I'm very new to doTERRA. I started in April. I've been using essential oils for a while, but I got introduced to doTERRA through my acupuncturist. So I'm just trying to soak up all the information. And I tuned in today just because a few of my family members are having health issues. So it would be nice to be able to help them. My father, he just had a minor procedure on his heart. So I just want to be able to support him and just to learn. Yeah.
Great. Leah, I got your email. I'm going to send you those protocols. And I just have to give Leah a shout out. She's enrolled 8 people this month. Ah!
Thank you.
You're welcome. No, thank you. Good job. Okay, so thank you for introducing yourselves. I'm so excited. This is a good starting point. Super excited that everybody's kind of open and excited to learn some things. So what we're going to dive in today is about blood sugar and controlling blood sugar naturally, and protocols that can be used for diabetes and associated symptoms of diabetes. So I have a little information that I want to give, but what I really want this to be is a round table. Like, I want to know from my acupuncturists where you would put these oils. I want to know, like, V, if you have any thoughts on a Qigong, like how that might incorporate. Mary, I'm going to kind of count on you to make sure that I don't mess up anything, you know, related to the macro and microvascularity offshoot symptoms of diabetes. And if you have anything, I also would like for Mary to speak a little bit about what doTERRA has talked about, the research that they're doing, and what we are guessing that's going to be rolling out in doTERRA because of the research that they're doing on diabetes. Is pretty exciting. And she was a part of a medical symposium that I'm hoping that she will chat a little bit about. So just first offhand, let me share my screen, and I'm going to show you this protocol because it was actually this protocol that I'm like, people need this, and how do I get this information out to the right people that are dealing with clients that have this specific issue? So as I'm showing you these things, please think about the other things that people are really struggling with that you know. You know, should we focus on heart disease? Should we focus on asthma? Like some of those things. So this was all a protocol that was used by a doTERRA wellness advocate. She had a history of 3,285 needle sticks annually. Her blood sugar 300 range, and she's insulin resistant. So this brought her blood sugar down to a low 100 range. Recommended to AC level every 3 months or bounce blood sugar or as needed. So this was kind of a protocol to get some stabilization and then as needed to hold it. So this is what this person did. And I really feel like this is an important thing. There's one thing that I want to talk about before I talk about this specific protocol though, because I feel like every acute issue will be best addressed if first and foremost nutrition is addressed. And you all know how much I believe in healthy whole food nutrition, and what we can't get from food, we need to get from supplementation. So before any of this, I would have people be on LLV, period. Like as a part of a wellness lifestyle, as a part of restructuring your metabolism, as a part of getting the nutrients into your organs that it needs to run effectively. That would be step one. Step two, I would really look at toxicity in people's lives and looking at what they can take out. In this case, it would obviously be sugars, right? Like anything that's like, do they drink soda? Are they ice cream addicts? Whatever, all of those kinds of lifestyle and eating habits, I would take a little closer look at, like, what do we put in? What do we take out? We put in the LLV, we take out some things. And then, looking at the other lifestyle factors, we're looking at toxicity, we're looking at sleep, we're looking at stress management. All of those things are going to have implications on blood sugar levels. So these are more for acute, like when we've established that there is a severe problem, these are some things that have worked for people. So balance, 1 to 2 drops on the back of the neck and bottom of the feet in the morning. This helps regulate a lot of different things, but I think it's also just to start the day off where we're not in a kind of a flight or fight response, where we're getting grounded right off the front end of the day. Helps when our mood is stabilized, everything is a little more stabilized. So then, lavender, 1 to 2 drops on the big toes every night. Again, this is helping implement good sleep. Sleep is where we restore. Sleep is where we regenerate. Sleep is where our body uploads new information, new patterning. So this time is really crucial to make sure that people are getting great sleep. Aroma touch technique when available. The other thing, let me think, I would also maybe recommend a Symphony of the Cells protocol if someone doesn't have access to an aroma touch trainer or aroma touch technique. Then what do you think, Jess? The Chi protocol?
Let me take a minute to think about that.
Okay, and I can look in Boyd's book too. But the thing with the Symphony of the Cells protocol is that a 7-year-old could do it for you. You don't need like a person that's been trained and certified in aroma touch to get the benefits of the oils when used in the Symphony of the Cells protocol. So that would be something that I would definitely add 1 to 3 times a week. Recommended daily lifelong vitality. I can't say it enough. Terrazymes are going to be huge to not only break down the food, but helps with absorption of nutrients for the body. Using these 3 oils in a veggie cap. According to the results, I love that they have a little sliding scale, like depending on where your numbers are actually at. Using coriander, which helps balance blood sugar. Cassia stimulates the beta cells to stimulate the pancreas. And then grapefruit, it's helps metabolic balance and controls appetite. It's also a really good cleanser for the kidneys. So that this scale represents how many drops of coriander, cassia, and grapefruit to be used in a capsule. I'm going to have Mary talk about cinnamon in just a second. I think that we could probably easily add cinnamon to this protocol and it would make a lot of sense. Also applying 1 drop of Balance, Helichrysum or Deep Blue and Wild Orange over the kidney using the palm slide, which basically looks like this. So I'm trying to think. Okay, here's the kidney. A palm slide is you take your hands and you're just sliding it across. Palm slide, super simple. The protocol, let's see. So you understand that it's real specific per numbers, like it depending on where their range is. So I would like to open it up. Oh, also, if anyone wants me to email this to them, you just have to send me an email at wellnessmattersinc@gmail.com, and I will just reply to that with this PDF. And you can do what you want with this.
Just looking at the Symphony of the Cells book, it looks like the C2 protocol is the one that is most applicable. That's the one for, it's really strong for cellular repair, which makes sense.
Okay.
And also autoimmune disease, so the C2 protocol.
Okay, perfect. So that is a super simple, if anyone wants that protocol and doesn't have the Symphony of the Cells, put that in your message to me and I'll take a picture of the protocol and I'll add that to what I email you. Okay, I'm gonna stop sharing for a moment because I want to hear kind of, Mary, would you start out just by talking a little bit about adding cinnamon to that protocol? And then I wanna move into kind of microvascular offset issues. Unmute yourself, babe.
Real quick, let me just add, it looks like the cardiovascular protocol could be indicated too. So for Symphony of the Cells, C2 and or cardiovascular.
Perfect. Thanks, Jess. You have to unmute yourself, Mary.
Sorry.
Okay, there we go.
I'm toggling between multiple screens and I lost the video. So I'm like, I don't know how to unmute myself right now. So about cinnamon oil, I can't speak to the exact mechanism, but I do know, as Jess alluded to when she was sharing her screen, it does support beta cells in the pancreas to boost. So the beta cells in the pancreas are responsible for insulin production. And there's 2 different main types of diabetes. There's type 1 diabetes where essentially it's autoimmune, the body attacks the beta cells in the pancreas. So then there is no possibility for our body to produce insulin. So those people are dependent primarily on insulin. And then we have the majority of diabetes cases, which is type 2. And there's a lot of key players there. A lot of it is increased or decreased insulin sensitivity in the tissues. And then the liver is primarily responsible for cranking out glucose production. And so really things just stop talking. And then the beta cells in the pancreas aren't releasing insulin as they should to lower and to counteract the glucose that's being cranked out in the liver. So cinnamon is responsible for helping to increase our endogenous insulin production in those beta cells. And when I went to the medical provider symposium, they didn't have any results yet. That was still pending. What they were really studying and what doTERRA is focusing on primarily right now, which really speaks to like my language as a pharmacist, is pharmacokinetics, which is the absorption, distribution of how it distributes in the body, how oils are metabolized, and how they're eliminated. So there's like the 4 steps when you take in a medicine or you take in any kind of essential oil. Every chemical we put in our body is metabolized differently. So they were studying cinnamon oil to see how it's absorbed, at what dose, and like the safety of it. So those results were still kind of preliminary, but they did formulate cinnamon and enteric coated capsules for this study, meaning it releases in the
Bet
lower
they're gonna
GI.
come out.
Yeah, and so I have a sneaking, they were super kind of, they would not disclose where this information was going, but it's a study that's ongoing with Roseman University. And they're kind of our peer-reviewed university that doTERRA does their research with. So right now they're focusing on the safe and effective use of cinnamon, and for the reason of not just diabetes possible management, but also for doTERRA is really pushing for obesity rates in the US and the metabolic syndrome. So not only were they looking at cinnamon for that, for lowering blood sugars, but it's also something that's in Slim and Sassy. So until we actually have a crude cinnamon oil product to help with blood sugar lowering, something in the interim to help support people who do have diabetes or are working on weight loss would be Slim and Sassy for that reason, just for boosting your own insulin secretion and lowering glucose levels, helping curb appetite as well with the grapefruit and the Slim and Sassy. So yeah, there's just a lot of focus right now, and I think we're going to see a lot more in the pipeline for just different ways we can address not just diabetes, but as we know, type 2 diabetes is heavily related to obesity and the metabolic syndrome. So they're kind of tackling all of that.
Oh, perfect. Thank you, Mary. Thanks for breaking that down a little bit. I love how you talk about sciencey things, makes it easy to understand. So I really appreciate that.
Sure. Yeah.
I want to mention a couple things kind of in alignment with what Mary's talking about. There's people that suffer from diabetes. First of all, there's the autoimmune connection, right? I'm going to have Jess talk a little bit about maybe some things to think about for any autoimmune issue, including diabetes, if she wants to. And then also, I'm thinking also about some of these peripheral things that happen to people with diabetes. Like, for example, the microvascular things like vision loss. What I would recommend for that is frankincense or immortelle around the eyes. Severe neuropathy is a super common issue for people with diabetes, sometimes in their hands, sometimes in their feet, sometimes in other parts of their body. Kind of the common neuropathy oils are frankincense, helichrysum, eucalyptus, lavender, marjoram,
Cypress.
basil, cypress, peppermint, and aromatouch. So those are, and I mean, there's like 100 different neuropathy blends. I know that Kim Good, Angie's sister-in-law, has a really good neuropathy blend that she uses for, I think it was her father-in-law, or no, must have been her someone that was really, had a super great results with neuropathy pain. So that's another kind of offshoot. I would even add copaiba to that list now. And because frankincense is such a powerful regenerator, I would probably put DDR prime internally into that protocol as well.
Mm-hmm.
And then thinking about some of the macrovascular issues that are commonly related to diabetes are things like circulatory problems, right? So we're looking at the heart. So thinking about oils that support the heart would be really great. Also, things like kidney issues. So, you know, juniper, geranium are really great for the kidneys. Let me look real quick. I have a question about, so, you know, heart conditions, some of the best oils for heart issues: cypress, ginger, helichrysum, lemon, lavender, marjoram, thyme, wintergreen, ylang ylang, aromatouch, and deep blue. Careful with deep blue and heart conditions. There are some contraindications on warfarin or blood thinners and related to menthol in deep blue. The other thing, you know, I hear people complaining about as related to diabetes is erectile dysfunction. I've seen that issue turn around with just LLV, but there are also, usually that points back to the heart and circulation. So that's where I would go when thinking about that. Also kind of from a spiritual, emotional place, Louise Hay says that diabetes is a condition of, like, she talks about it from an emotional standpoint. It's a condition of longing for what might have been, a great need to control, deep sorrow, or there is no sweetness left in life. You can kind of see blood sugar sweetness in life. And then just a quick mantra or affirmation around that might be, this moment is filled with joy. I now choose to experience the sweetness of life every day. So those are just kind of some other offshoots. So I'd like to kind of hear from you guys, like anything that you're that's coming in for you as far as other things to consider when treating or advising, I should say, mentoring people through their wellness challenge of diabetes or autoimmune issues. Does anyone have any thoughts on, from your perspective, of things that might be important to consider?
I would just add, it's definitely a paradigm shift for me in how we approach these patients. Is in Western medicine, it's like, okay, we have the thing, let's treat the thing instead of the root. And if you look at, so just to rewind, like the complications of diabetes being microvascular, macrovascular, that's from an accumulation of blood sugar that causes damage to tissues over time, right? So yes, we're going to get people who we're going to have to, that are going to be in that camp and are going to need some symptom management there. Ideally, the theme here is going to be nutrition. It's going to be LLV. It's going to be the omega-3s. It's going to get people to get that under control, and then we'll kind of naturally see improvement in all those other complications as well. And I just also wanted to add to the heart health, the turmeric dual chamber capsules would be a great option, and making sure they're getting the full dose of the X omega too.
Yes. Good additions.
And then just ongoing for like kidney support, lemon oil in the morning, juniper berry. Those are two things that could be supporting healthy kidney function.
Great. Thanks.
And one more thing from like a standpoint of a pharmacist is, you know, if you get someone with an extensive medical history who do have diabetes, it's worth noting what medications they're on. I know that's not something, like, as a wellness advocate, a lot of people, when you're doing your one-on-ones, not everyone feels comfortable like getting a full med list, but some of these people are on like 10, 15, 20 medications. And, you know, essential oils generally are safe, but there are some that do interact with meds. So that is just something worth considering and to just kind of be thinking about. And if you ever don't feel comfortable making a recommendation for someone because they're on like a laundry list of meds, that's where you just kind of like reach out to your, to us, you know, for support. There are resources that kind of help out there that break down drug interactions and how to kind of navigate those.
Thanks, Mary.
Mm-hmm.
Jess, do you have any thoughts, any input or things around points or autoimmune or general thoughts and meanderings?
I have a lot of thoughts. Let me try to put them into words. From a Chinese medicine standpoint, you know, acupuncturists act like investigators. We're always like trying to sleuth out, like what Mary said, what is the root of what's going on. So like the fact that your body is not responding to insulin anymore, or the idea that your body's attacking your pancreas and as an autoimmune condition. Like there's always a reason why under those symptoms. So trying to explain that to someone without a background in Chinese medicine, I guess what I would say is that it does, like what Mary and Jess were saying, it does go back to gut health, I think. In Chinese medicine, it's interesting because the two main organs in Chinese medicine that are responsible for digestion are the spleen and the stomach. There's a little bit of controversy over whether or not spleen, the Mandarin word for, or the Chinese word for spleen, could have been mistranslated, and it could mean pancreas instead. So going back to spleen health and stomach health in Chinese medicine is super important. So whenever I see patients that have a history of diabetes or blood sugar regulation issues in practice, I always go back to, we call it the spleen diet. So it's like the way that we fortify the energy of the digestive system. And it's super simple. It's just having people eat cooked foods. From an energy standpoint, the reason that we recommend eating cooked foods is because anything you eat that's not already cooked up to body temperature, your body has to use its own energy to cook the food up to body temperature in order to like get the nutrients out of it. So if you can cook your food ahead of time, it takes energy off of your body to do that. And that energy usually comes from your digestive area. So eating cooked foods, eating earthy type vegetables, so like root vegetables, fortify the digestive energy. So if anyone ever comes to me with digestive deficiency, I always recommend like crock pot meals. So like beef stew or vegetable stew or chicken stew, like something that's really hearty that you would think about eating like as the weather's turning cold, because that's the season of digestive energy in Chinese medicine. And then, the basic culprits of like, don't eat processed food, like no processed sugar, no white sugar. Make sure you're getting adequate like protein and fat intake. A lot of these recommendations are more geared towards type 2 diabetes, which is like diet dependent diabetes. The autoimmune one is tricky because, it's a whole other ballgame dealing with autoimmune stuff, because those people do need sugar. So you can't tell people to like up their protein and not eat sugar. It's like they're completely different recommendations. So most of these recommendations I'm talking about are because they are either overweight and have metabolic syndrome with, like leading into the diabetes type 2. The other thing I will say is that hypoglycemia can be an indicator for can be a precursor to metabolic syndrome. So having like sugar crashes, so people that get like faint and lightheaded and might not look like the typical person that could have metabolic syndrome, that can still be a precursor or a risk factor to eventually developing metabolic syndrome later. I just wanted to mention that. And then the other thing I will say, and this is just because I've been learning more with Desiree about the emotional aspect of disease. Desiree studied a type of acupuncture called 5-element acupuncture, which we learned about in Chinese medicine school as well. But it basically, the tenet of 5-element acupuncture is that 99% of illness is rooted in emotions. So going back to looking at like what Jess was saying about with Louise Hay, and looking at what like the emotional root of both autoimmune disease and carrying extra weight on your frame than is needed, I tend to look at boundary issues. So in my clinical experience, the patients that I've worked with that have been carrying extra weight on their frame typically carry that weight as protection, like from the external environment. So really getting to the root cause of like, what is this person's boundaries? Can we do any work around boundaries? Like just something super simple that I've learned from Desiree is just putting tea tree oil on the insides of your wrist creases, just to kind of like fortify your energetic boundary, which is totally tied to your energetic boundary is totally tied to your immune system.
Yep.
They're like one and the same. So, using some of those protective immune oils in a way that's going to help fortify your energetic boundary could be really useful. So like tea tree, on guard, clove, petitgrain is really great for boundaries. Those would be the primary ones I would recommend. Oregano can be pretty good, lemongrass, black pepper. But looking at boundaries for sure.
Perfect. I love that, Jess. That makes a lot of sense. Vanessa, do you have any downloads for us or anything coming through for you, energetic medicine wise or other ways?
I would just reiterate what Jess just said, like looking at that emotional piece and, you know, since the kidneys are involved, fear is often a component of that. And then looking to it like and I know this is getting kind of outside of a lot of our scopes, but at trauma, you know, I think that a lot of us who experience trauma, whether it's a big trauma or a small trauma, how that impacts our nervous systems and the way that our body processes hormones and cortisol, that all comes into play. And so if we're able to address some of that, and I don't have enough knowledge yet about the oils, but one of the oils that was kind of coming to me that and Desiree had spoken about it was the black spruce. So I don't know how you guys feel about that who know more about the oils, but if I'm remembering correctly from the energetic channel theory, like it really hits all of those channels. Am I remembering that correct, Jess?
Yep.
Okay. So, you know, it's addressing the heart and the kidneys and the lungs. And so, you know, and with the lungs, we might look at grief too as part of our boundary issue. So that's just from a very minimal understanding of it.
Perfect.
But that's, yeah.
Yes, thank you. What a sweet puppy you have there.
This is Ranger.
Oh, sweet. You know, the other thing that I kind of came to my mind when Jess and Vanessa were talking was this idea of, you know, autoimmune issues are oftentimes when we're going against ourselves. So at the same time, like keeping that boundary, it's like, where are we not honoring ourselves? Where are we going against our beliefs or our wants or like that? Sometimes that can perpetuate autoimmune issues and show up physically in our bodies as well. Okay. V, Ange, Leah, do any of you have anything that you want to add from just your experience or any thoughts or anything that like you've seen work for people or anything before we shift a little bit?
I don't
I'm
think so.
steadily writing notes down. I have Hashimoto's and it's a battle. So I'm just like steadily just taking it in.
Good. Can
I just wanted to add one thing. Vanessa, thank you for bringing up cortisol. So cortisol is directly linked to insulin resistance. And so we know that cortisol production is like our main stress hormone. So yes, like the emotional piece and managing stress, the black spruce, balance, adaptive, all of that. If you identify someone who is kind of living in a chronic stress state or has some underlying trauma, would be definitely worth using our tools for. I know Whisper is a good one for cortisol too. So that's good, a really good point to bring up. Thank you for that.
Okay, V, did you have something that you want to share? Oh, unmute yourself, babe.
I think it started with the
rodeos, like you've never been on a Zoom call before. What's going on?
I wish I'd never been on one before. But no, there was a whole thing around cortisol and dopamine and the relationship between those. And I would say in studying the 5-element system and the calendar system, it's very interesting that we're right in the beginning of the summer, which is the fire part of the year, where the heart is it's the main organ, and that the sound for that, the emotional sound is laughter.
Oh.
So if you look at generating too much sugar as a result to be happy, One of the simple prescriptives, it can be laughter. And in the emotional, there's a bunch of sounds that are relative to organs, and the sound that's relative to the heart is ha, which again is a laughter sound. Yeah.
That's amazing. Dee, that's such an interesting point. And like when we look at like a holistic person and bringing in all the tools, that's such a huge and like a beautiful medicine, right? Like laughter as medicine. Yes.
You heard that before. Yeah.
Right. Thank you for that. That's brilliant. I love it. So good. Okay, so I know that some of you are successfully growing your doTERRA businesses, and I just want to see if there are any like Aegis specific questions about integrating doTERRA into your practice. I don't want to spend a ton of time on that, because what I really want to know too is like, where do we take this group? Like, I know that there's probably 20 other people that wanted to be here today that want to be a part of this roundtable. What do you think? I mean, today was super valuable for me, like getting kind of everybody's thoughts. And then, you know, one thing I wish what I'll probably do is rewatch this and kind of pull in everybody's suggestions and make a new kind of like blood sugar protocol that does hit on like the laughter and the emotional piece and the stress piece and all of the things. Is there anything that I'm missing? And B, is this like, does this feel like a good flow of like information and exchanging ideas and like that? First, just let me ask that question.
I think this flow works with this many people, but I think if there were 20 extra people on here, I think it would get really long. So what I would like to see is maybe a little bit more structure in terms of like, for next time, maybe we choose a topic ahead of time.
We're going
to
do it today.
You, Jess, you could choose like, you know, 3 or 4 other health practitioners to speak on the different components for that, for the education piece, so that we're hitting everything, but you're not having to do all of the work. It's like You're pulling from your team and the expertise of your team. And then that way it's a little bit more, like it's not so open-ended. I feel like this would take forever if there were 30 people on here.
Okay.
Yeah.
Great. That's good feedback.
And I do think it would be good to try to recruit and get representation from like, I love that we have acupuncturists and me as a pharmacist, but it'd be also really valuable, I think, to get other people from different disciplines just to represent their perspective and any insight that they can bring, so that we have a more collaborative, cohesive model, because that's something that's missing in medicine. It's like disciplines aren't talking like they should. Specialists don't talk. So if we have that platform where we can all be together and sharing from our vantage point, I think that would be super valuable.
Great. For sure.
And I'll work on, I have a few nurses, I have more pharmacists.
I'd love to get a chiropractor on board, just nervous system related. Okay. Business questions before I move on. What I would like for you to, I don't know, maybe an invitation for you to think about this business in a way that's not just about making money, but it's about giving people tools to do when they're not with you, when they're not like in your service and in your practice. Like, what can you have them doing outside of that world to help them not need you as much? Energetically, it's not going to make your business grow less. Like, it will grow more when you retire people out of your care, right? So that's just an invitation for you all to think about that. So before we kind of close, what would be a juicy topic for next time? What do you hear that people are dealing with the most right now? What is like makes sense seasonally, in the world at large, energetically? Do I have any thoughts?
I think that the mind-body connection and with like the emotional body and and the physical body, like that's something that we don't often visit in the Western world. It's like disconnected. And I just love that that was like somewhat of a focus. So I would love more of that.
So I think that's going to be a part of every one of our calls, because really, no matter what we're looking at, we're always going to look at that kind of bigger picture. I think that that's going to always be important. And it's kind of like a little bit of the base structure of everything that we talk about, right?
But do we kind of want to start with a base structure and then like start bringing in disease states into that? I mean, like with the foundation.
I feel like it would be exhaustive, and there's so much like that. I have a hard time thinking that I could make sense of that in an hour.
Right.
And I feel like if people are coming to this call, they're going to have some sort of baseline understanding of the body, mind, spirit connection and wellness and well-being.
Right.
I can speak to it. I mean, I will be speaking to it on no matter what disease specifically we're talking about. But, you know, thanks for bringing that into the awareness, because some people, especially from the Western world, that's not probably the first thing they think of. Whereas like in my world, that's the first thing I think of. So I think that there's a place for that to be like, maybe focus more on those pieces of whatever pie we're talking about.
I would love like the content to just be accessible to the Western world, you know, because I think all of us on this call can get so like super woo woo, like, and we love that. But that's also what kind of is like, can sometimes be a little bit scary to people who are more versed with Western medicine. Like that could be a little off-putting. So I don't know if, depending on who you want on the call, if like the goal is to be recruiting like new people who aren't as familiar with this world, or people who are already like super familiar with doTERRA and deepening our knowledge. I guess it kind of depends on who your audience is. And like for me, like my personal goal is outreaching and like infiltrating the Western world. So that's
and then
kind
what
of
I would say is like, I would say that it's your opportunity to kind of get them to baseline.
Mm-hmm.
Like understanding that the world of plant medicine is an integrative approach, and that we are always going to be talking about bigger picture, lifestyle, well-being, the body, mind, spirit, wholeness, like that. Even just saying that, so that they know that that we're going to be talking in it that way.
Mm-hmm.
So
right.
maybe feeding them a little bit of that. I mean, I can talk a little bit, but yeah. I'm really looking for like more specific like areas that we can focus on.
I think we should do thyroid.
Thyroid?
Mm-hmm.
That's coming up a lot?
I just think it affects a lot of people, like a lot of women in particular.
I think you're right. And that we can like, that's another one of those topics where hyper, Hashimoto's.
I think skin conditions would be really big. Eczema and psoriasis. You want like, I don't know how you feel about doing like depression and anxiety.
That's what I was going to say too, with the anxiety, especially like going in with what
the season that we're in right now.
That we're going into the heart. So anxiety and palpitations. And then a lot of people are having anxiety with COVID-19.
Mm-hmm.
I think it could be interesting to talk about adrenal fatigue, just like what Mary was saying, like both sides of the equation, because a lot of Western medical practitioners don't even recognize that adrenal fatigue is real. So maybe looking and like breaking it down in terms of why is that and what can we do? Like, why could that be true and why could that be false? I think that could be interesting.
Yeah, I think that could be really topical too, because the whole thing is that because of COVID-19, one of the detriments is that everybody walks around in fight or flight.
Yes.
So you're walking around adrenally sacked, and then you fry it out real quick.
Good point. Okay, so
and then maybe digestive stuff, Jess. Like Leah was asking for like IBS, Crohn's, like those types of things. I think that could be pretty applicable. Like applicable. I'm just trying to think of like on the Facebook pages that I'm part of, of the gold and platinum page, like what are the questions I see most from wellness advocates that they need support around, and these are them.
Okay.
How about fertility issues? I know that's your wheelhouse, Jess, but
Yeah, that would be good.
I think I'm of that age where I see it a lot because
Yeah, that would be
close
great.
friends are in their 30s and struggling to conceive, and I don't think people realize they go to fertility clinics. I don't even think they realize there is an integrative, holistic way to approach that.
Totally.
Great.
I was also thinking maybe more chronic illnesses like Lyme,
Mm-hmm.
Epstein-Barr, maybe. I don't know. Yeah.
Okay. Well, this gives me like 8 months worth of workshops. So how about if we start, because I think that like I want to follow like the cycle of nature. So I really feel like and the state of the world, like if we focus on depression and anxiety next time, that we could probably, I mean, easily fill an hour with things. I would love if anybody on this call is like, yes, I have some things to say about that you would want to partner with me and taking a segment of it. Like, you know, V, I would love it if you kind of feel into that piece of the Qigong piece. Like, what is the sound of, what's that piece look like? And what would you bring to that table? And Jess and Vanessa, like from your standpoint, like Vanessa from the emotional piece and that like trauma wounded, you know, I think Jess, you could help with like kind of the points and oils and things like that. We all have like a lot of information and there's so many tools in our toolbox around that. Maybe Mary, I know that you're really good at talking about and helping people understand reduction, de-escalation, and titration. Like how do we, like if you are, how does that look? And what might be some ideas around supporting someone that wants to get off antidepressants or like that piece, so that we have a little bit of like collection of ideas. And again, maybe I'll start with some like basic stuff like adaptive and mood management and the mood matrix and like some of that. And then we go into more specifics like that, kind of like we did today. Does that sound reasonable?
I would love if Mary could talk a little bit about drug oil interactions, because I hear questions about that a lot, like what oils are safe to take with antidepressants and anti-anxiety medications.
Like a whole topic in and of itself. If I had some time, I could help spearhead that, Jess, and just break it down.
Cool.
Do we need a whole nother call for that? Because we can, like we could do depression and anxiety next month, and the month after we could do drug interactions regarding antidepressants and oils or medications.
Use medications and oils, you know.
Yeah. Okay. So maybe come like next time with like a little bit of it, the piece that's like based on antidepressants specifically, and then we'll talk more about like making a guttier presentation around contraindications, interactions, the pharmacokinetics of oils and drug reactions.
Yeah.
Okay. Does that sound good? Was this valuable? Does this seem like we should be doing this? Does this make sense? Okay.
Yes.
I mean, like, honestly, I'm really looking for feedback because this is like a new adventure. So I just want to make sure that it has value for people and that like people are getting the information they need and feeling like you're not walking away more confused than you came.
I found it valuable, especially as someone who's starting out with this. And adding this to what I do. So I thought it was perfect.
Wonderful.
Good timing for me.
Great. Thanks for that feedback, Vanessa. Okay, well, that's all I have. Does anyone have anything else to contribute before Mary heads to the beach? Okay. Thank you so much for spending an hour with me today. I really enjoyed it. Hey, if you're not on the Business Pros page, please get on that. I listed the next 2 months of education, including oil camps, continuing education, builder business calls, and the medical roundtable. So all of those are already scheduled through July. So mark them on your calendars, share them with your team. This is where I do the work for you. Like, you just bring people. Oh, as well as I'm teaching 2 classes a month. Essential oils made easy for people that you're just wanting to share oils with, but you can't invite them to your living room to host a class. So bring them to my class, and then you follow up and get the enrollments, and I'll do the teaching. All right. So those are some of the opportunities that are there, and make sure you share those with your team as well. Okay.
Thanks,
Thank
Jess.
you so much. Thanks, Jess. Thanks, Vanessa.
Thanks, Jess.
Yeah, and
Thanks.
Mary, thank you for your time and your contributions today. I really appreciate it.
Yeah.
Thank you.